Here with 9 News, and I am here with Dr. Michelle Barron. She is with she's at the CU Hospital on the Anschutz Medical Campus, and she is taking your questions live. We're going to talk a little bit about the coronavirus. So, Dr. Barron, tell us a little bit about the virus. How is it spread? Do people need to be concerned?
Sure. So first, coronaviruses are actually very common. It's the most common cause of the common cold. And so we probably have all at some point had a coronavirus, and we just didn't realize that that's actually what was causing our symptoms. The one that is in the news right now that's coming out of China is a little different in that it's actually spreading to cause pneumonia and causing a lot more symptoms. And that obviously some people have died. And so it's something that I think people are a little bit more concerned about. Certainly, if you're traveling to China, I think that would be important to have adequate information regarding what precautions to take. But locally, I wouldn't say that you should be aware. I don't know that you need to be concerned at this point.
Okay, good. And again, we are taking your questions live, so there are going to be times when I'm going to look down at my phone just to get your questions. If you have questions for Dr. Barron about it, please feel free to ask. So another question, there was a case that just came to Washington. Can you talk a little bit more about that?
Sure. So the person had traveled to the region where there was ongoing infections. Coronaviruses are spread typically through what we call droplets. So someone coughs or sneezes and that lovely little spittle that kind of comes out and lands.
That moment.
That moment. Those are droplets. And so you may not have to be coughed or sneezed on. You may have come into contact with something that they have touched. Then you touch your eyes or your nose, and then that's how the infection usually starts.
That sounds like very similar to a common cold.
So it is. And so I think that's one of the things that, and right now we're still in cold season.
Yeah.
So right now, as far as we know, because this could obviously change, you still have to have travel to Wuhan to be considered potentially at risk.
Okay.
We have not seen any widespread outbreaks in Seattle, Washington, or anywhere else, but the situation could evolve. So we have to keep an eye on these things.
So we are starting to get some questions. Mary Ann asks, what are the symptoms?
Sure. So unfortunately, very nonspecific. Fever, cough, can get some shortness of breath, and probably regular good old cold symptoms associated with it.
How do you test for it? How would the hospital test for it?
So if you came to one of our clinics or to the hospital and you said, we actually have a standard practice of asking, have you traveled in the last 30 days? And you said, yep, I went to China. Then we asked the specific question, did you travel to Wuhan City? And you again said yes. Then we would put you in a room and then we'd start asking you more questions. Are you having fevers? When was the last time you were there? Were you around anybody that was sick? Tell us more about your symptoms. And then from there we would decide if you were a person under investigation. And the CDC has some pretty strict criteria regarding what that is. And then we would facilitate testing through the health department.
Okay, all right. I'm again looking down to take your questions. Tasha asks, what about children? I'm assuming maybe she's asking, are children in more danger? Are they an at-risk population?
It's a great question. And again, probably they are equally susceptible as adults. Again, travel is still the key piece of this. So you have to have had travel to that area for now. That again could change, but right now so if you were traveling with your family and you had your children with you, then there's that potential you could have been exposed.
Okay, so again, that's the key right now. If you would have had to have traveled to that area in China to be exposed to it. So the health officials, I'm sure, will continue to keep an eye on that. I know the World Health Organization is meeting about it soon and stuff, so we'll have more on that at 9news.com. Brandy asks, is this the same as SARS, SARS?
That's a great question. And so it's in the same family as SARS, so it's which is also a coronavirus. But it's considered a separate virus. So considered it like a cousin as opposed to being directly in the same family, so to speak.
Okay. All right. What are the symptoms of SARS? Are they any different than the symptoms of the coronavirus?
Again, very similar. Flu-like symptoms. Fever.
Tough on you.
Well, I think it's hard because it's so similar to so many other things that it would make me very anxious if I didn't kind of know better. And so that's why I want to emphasize at this point that it's still related to travel. And SARS at that point was associated with having been in certain provinces in China and then went to Toronto, and then being in Toronto was another factor. So a lot of the difference between this and SARS that we know of, again, at this point, is that it doesn't seem to have the same rate of deaths. Now, that could change just because I think information is slow coming in terms of whether they think the virus really caused the death or other complications.
Okay, all right. I'm curious, so say you happen to be traveling to China, what steps can you take to protect yourself? Wash your hands? Is it the same as kind of a cold? Wear a face mask?
Yep, absolutely. That's the current recommendation is just that. Bring surgical masks, have lots of good hand hygiene products, alcohol-based sanitizers, soap and water. And the CDC, actually, cdc.gov, has a really great website that has recommendations for travelers. And so it gives you an idea of other things that you can think about that maybe you hadn't thought of.
Okay. Jacob asks, I just came in, but how lethal is this? So I know you've answered this question already, but people are joining us more and more.
No,
So.
that's great. I think we don't really have a full appreciation for it. Certainly there have been people who have died, but we don't really have all the information as to were they older, were they younger, did they have any kind of complications because they had cancer or other things. And so I don't think we have a good handle. We know some people have died from this.
Yeah, I think
and
the
so,
latest was 17.
Yeah, and so that's a little different than most cold viruses don't typically kill you. But so I think that's the distinction of why we're paying so much attention to this.
Okay. Kat says, my son is flying back to Colorado from Vietnam this week. Should I be concerned?
Not at this point. Again, as long as he hasn't traveled again to the Wuhan city in China. Again, other parts of Asia certainly are seeing individuals that came from that are becoming ill, but that we know of, Vietnam is not considered a risk at this point.
Okay. Adane, I apologize if I mispronounced that, is asking, how could we differentiate between flu and C virus?
Great question. They will have actually potentially very similar symptoms. Coronavirus, if it's not the novel one that's actually in China right now, would just call cold symptoms, whereas flu generally gives you more systemic. You feel more fatigued. You tend to be wanting to stay in bed, and you tend to have much higher fevers. I think at this point, unless you've traveled to the region, the likelihood is if you're having flu symptoms, you probably have the flu. And we're still seeing lots of flu and certainly other respiratory viruses like RSV and some other ones that just make you feel crummy.
Okay. We're getting lots of questions now. So, Thomas, I think your question of what sets this aside from the common cold other than death, I think we kind of just answered that.
Yeah.
So, another question, I don't know if you can answer this maybe to the best of your ability, but it sounds like LV is wondering, should we be concerned about the aircraft the person, the infected person traveled in? I don't think that the doctor can answer Dr. Barron can answer how many more trips and people were in that aircraft. I think she can help help us understand if the aircraft could get infected or if
So the way that droplets work is really it's a function is either I have to literally cough on you or you have to touch a contaminated surface.
Okay.
And that's true for almost all the respiratory viruses, including flu. And so if you're worried about you're on an airplane and you maybe don't know where somebody's traveling from and you're concerned, wiping surfaces down with the antiseptic wipes is a really good idea. And then really just keeping your hands clean. That's because every time we itch our eye, itch our nose, or we pick up something to eat and we haven't actually washed our hands, whatever's been on that surface before, potentially you can get. And that's often how we end up with cold viruses.
Okay, yep. So it's just like common cold, wear a face mask, wash your hands. If you're really worried, you can maybe bring like a baby wipe and wipe down your seat.
Yeah, so they actually have alcohol, like wet ones and some of the other ones where,
a lot of them provide that.
a lot of them provide them nice little packs that fit in your purse. And yes, I'm one of those crazy people that even before this did that. I wiped down everything. I wiped down my seat handles. I wiped down my tray, everything I can think of just to try and
be safer around.
Yeah, I just don't like getting sick.
Exactly. Mary Ann asks again, is the virus cured by any treatment?
That's a great question. No, most viruses don't have cures, so a lot of it is a function of letting it run its course. So we do what we call supportive therapy. So if you are down on fluids, we give you fluids. If your fever's really high, we'll try to lower your temperature. And if you're having trouble breathing, obviously supporting that.
Okay. Looking at your questions. I'm gonna try and ask this question in a way I think Dr. Barron could maybe answer it. Helene, the person who came to the U.S. that is sick, should they be quarantined?
They're probably under some type of isolation and being monitored. Now, when we talk about quarantine, that can mean lots of things. So sometimes that just means in the hospital that you have a private room and people have to wear masks and gloves and gowns when they go to see you. If he's well enough to be at home, they probably recommended that he stay at home and probably limit the amount of, excursions outside of the
Makes
house.
sense. Limit the amount of people he comes into
Yeah,
contact with.
exactly.
Yeah.
I think again, until we know more about how this is spreading, we know there's probably person to person spread, but we don't know. Like if I was just next to you, is that enough, or do I have to be someone that lives in your household and you have
Right,
a lot of exposure?
contact with. That makes sense. Okay. All right, well, I think I'm not really seeing many other questions here, so let's just recap one more time for the people that just joined us. Mention again that you had to have traveled to this particular part of China
To be potentially exposed at this point. Certainly, this is an evolving thing. As more information comes out, I think you will become, again, aware of it. For those that really want to read up on it, the CDC and the World Health Organization have great websites and has great practical information for people that are traveling or just want to understand this a little bit better. And they differentiate between for just information, and they have stuff specific for healthcare providers. And so I think a lot of it is still understandable, even if you're not a healthcare provider.
Okay, thank you. And then obviously we will continue to follow the story on 9news.com, on all our 9 News social media feeds. We'll have some more information coming out later tonight with Dr. Barron and what kind of questions, we'll kind of dissect your questions in a web story that should be easy to digest for you. And you can always email us at newstips@9news.com or send us a Facebook message if you have more questions, and we will do our best to answer those. Thank you, everyone. Have a great rest of your week, and thanks for joining us for this Facebook Live. Thank you, Dr. Barron.
Thank you. Stay healthy.
Bye.